I'm very pleased to be here today as we celebrate National Breastfeeding Month with this beautiful photo display and the narratives of mothers and their babies from our community. Observing National Breastfeeding Month promotes the importance of breastfeeding for both infant and maternal health, encourages support for breastfeeding mothers, and educates the public about best practices. I want to express my gratitude to all of the mothers, fathers, and their beautiful children who participated in this photo session. I also want to thank the Bermuda National Breastfeeding Committee for organizing a month-long series of events to educate and support breastfeeding in our community. Your theme, Closing the Gap, Breastfeeding Support for All, emphasizes the critical need for inclusive and comprehensive support for breastfeeding mothers throughout Bermuda. It is vital to ensure that every mother, regardless of socioeconomic status or race, receives the encouragement and resources necessary to breastfeed successfully. This support should extend beyond healthcare providers to include community spaces, family members, businesses, and workplaces. By understanding the diverse challenges mothers face, from inadequate lactation support to a lack of breastfeeding-friendly environments, the entire community can learn how to offer effective assistance. These posters and narratives highlight personal stories illustrating where gaps exist and how we can all contribute to a supportive, inclusive network for breastfeeding mothers. Through these shared stories, the initiative promotes a deeper understanding and appreciation of the importance of breastfeeding in nurturing healthy families and healthy communities. Thank you.
So you mentioned increasing resources for lactation services. Can you know what those resources might be?
Well, I'll yield to the technical team in a moment, but what we want to do is also encourage businesses in their own personal spaces and environments, private and public, to have lactation resources so that mothers have adequate places for them to breastfeed throughout the course of the day. They shouldn't be having to hide somewhere in a corner. They should be having facilities made available to them to promote breastfeeding. Do you want to add to that?
So one of the reasons why we decided to do this campaign was, as the Minister said, to normalise breastfeeding and to increase resources. Exactly that means just encouraging more businesses to open up spaces, as the Minister says, for breastfeeding mums to be able to breastfeed in a supportive environment. So it's exactly that.
Can you talk about why there may be a stigma surrounding breastfeeding? Why that may be?
So I think the stigma has materialized over the years with female breasts being looked upon in a different way other than for breastfeeding. And I think that's where the stigmas materialized.
I think the answer is correct. I think, unfortunately, that we view breasts in a sexual manner, and perhaps it's been promoted largely, regrettably, by men, but in any event, it is a natural part of our bodies, which has been used to help to provide nourishment for our child. So I think in those circumstances, we need to change the framework and change the mindset to recognize it's a very normal and healthy endeavor for mothers to do to help to support their children.
And can you talk a little bit about some of the other events that are scheduled for this month?
So Kelly, do you want to?
Oh, sorry, Kelly.
Sure. So these posters and pictures and narratives will be displayed this week at Washington Mall. Next week, they're going to be placed at the hospital as well. We have 2 podcasts that are coming out in the coming weeks discussing different themes around breastfeeding. And then on the 21st of August, we are screening a documentary called Milk, just exploring different sometimes challenges and issues that occur with breastfeeding around the world. And then our last week, we're going to be, as mentioned, the businesses who are supporting breastfeeding or wanting to be recognized for that. Their names will be posted on a public registry for mothers to access so they know where they can be going. Thank you.